The lumbar puncture was first used by Heinrich Quinnick in December of 1890. He performed the procedure on a 21-month-old boy that was in a coma and had a fever, pneumonia, and a stiff neck. By the year 1900, he reported the technique of using cocaine as anesthetic for the same procedure. For a lumbar puncture, first the patient lies on their side with their knees pulled to their chest or sits and leans forward on a stable surface. These positions flex the back and widen spaces between vertebrae, making it easier to insert the needle into the lower back. Next, anesthetic is injected to the lower back to numb the puncture site and will sting briefly. Then, a thin hollow needle is inserted between two lumbar vertebrae through the spinal membrane, which is called the dura, and into the spinal canal. The patient will only feel a slight pressure in their back during this step. Now, the pressure of the cerebrospinal fluid that surrounds the brain and spinal cord is measured, a small amount of fluid is removed, and then the pressure is taken again. The pressure of the cerebrospinal fluid can help with analysis. Finally, if needed, a drug or substance is injected, then the needle is removed and the puncture site is covered with a bandage. The risks can include a headache caused by a leak of fluid into the tissues, which occurs in around 25% of patients and is accompanied by nausea, vomiting, and dizziness. There can be bleeding near the puncture site and rarely into the epidural space, and most patients will experience back discomfort, pain, and tenderness in the lower back, which radiates down the back of their legs. Brainstem herniation can also occur, which is when increased pressure in the skull caused by a space-taking lesion can lead to compression of the brainstem. Healthy spinal fluid should be clear and colorless, and during analysis it is compared to distilled water to check for abnormal coloring. White blood cell count should be in the vicinity of 5 per microliter, and it should have small or low amounts of glucose and protein. During analysis of the cerebrospinal fluid, there is measurement of the fluid's physical characteristics and its appearance. There are chemical tests on substances found in the fluid. There are comparisons to levels of similar substances that can be found in blood. There are cell counts and typing of cells found, and the identification of microorganisms that could be the cause of infectious diseases. Lab results combined with information taken during the procedure can help establish diagnosis. Abnormalities in cerebrospinal fluid can indicate problems. Cloudy yellow or pink coloring can indicate abnormal bleeding, green coloring can indicate infection, and elevated protein levels can be infection or an inflammatory condition. More than 5 white blood cells per microliter or low glucose levels could be an infection or condition. The presence of bacteria, viruses, fungi, and other microorganisms could be caused by infection, and abnormal cells such as immature blood cells could indicate certain forms of cancer. A lumbar puncture may be ordered for a number of reasons such as severe headaches, a stiff neck, flu-like symptoms that persist or intensify, hallucinations, seizures, fatigue or muscle weakness, severe nausea, dizziness, numbness or tremors, difficulty speaking or walking, severe mood swings, or poor coordination. The results of a lumbar puncture can help to detect meningitis, tuberculosis, intracranial bleeding, neurosyphilis, certain tumors, and multiple sclerosis. Multiple sclerosis is an autoimmune disease of the central nervous system. MS is a chronic condition where the immune system destroys the protective covering of nerves called the myelin. This causes inflammation and damage to the myelin, which is needed for the transmission of nerve impulses. The damage can disrupt these nerve impulses. Results of a lumbar puncture can help the doctor determine if the immune system is attacking itself. In patients with MS, the spinal fluid will have an elevated level of certain proteins, specifically oligoclonal bands. Some patients also have a slight elevation in cell counts. However, these results only indicate an abnormal immune response and aren't specific to only MS, so a lumbar puncture is only part of the total testing needed to diagnose MS. Along with this, 5 to 10% of MS patients will not show signs in their spinal fluid, which shows how necessary the other testing can be.